Hello, this is Blas Martinez with Laredo Insurance Associates. Welcome to the first online enrollment for Open Enrollment 2022. Online enrollment will be available on October 11th, 2021 through October 29th, 2021. It's important to note that if you're currently enrolled in any of the following plans, MetLife Cancer, Sun Life Disability, Sun Life Optional Life, and the Flexible Spending Accounts, online enrollment is mandatory in order to continue these benefits in 2022. You must go through and select each of the benefit categories, and to complete the enrollment process, you must click the word Submit at the end of your selection. The payroll department will have enrollment assistance available for those without access to a computer by appointments only. Please contact our office, Laurel Insurance, at 956-724-9083 for additional assistance with any of the benefit plan questions. Today we'll be discussing the choices that you have for your online enrollment. We'll go into detail on the medical plan and review the benefit options that are available there. And then we'll also discuss the additional benefits such as your dental insurance, your life insurance, disability insurance, cancer insurance, and vision insurance. All of these changes must be made online, and remember, if you're currently on the voluntary life insurance, the disability insurance, or the cancer insurance, a re-enrollment process is required. Failure to re-enroll will mean that your plans will cancel effective 12/31/2021. For your 2022 choices on the health insurance, everything stayed the same as compared to last year. We have the Silver PPO Plan, which is a CDHP plan. We have the Gold PPO Plan, and we also have the Gold HMO Plan. All three plans are available to you. Right now is a chance for you to make any kind of changes, and I'll go into detail as to how these plans work. For your deductible on the Silver PPO CDHP plan, the deductible is $3,000 if you're in network. For the Gold PPO and the Gold HMO, your deductible is $3,500 on both plans if you're in network. For the out-of-pocket maximum on the Silver PPO CDHP plan, the out-of-pocket maximum amount is $3,000. And for the Gold PPO and the Gold HMO, it is $8,150. Primary care visits, if you're going to go see a primary care doctor or a specialist or an urgent care or virtual visits on the Silver plan, you must first cover your $3,000 deductible, and then after that, everything is covered at 100%. For the Gold PPO plan and the Gold HMO plan, office visits to your primary care physician are $40, $60 if it's at a specialist, $75 for urgent care, and you have a $35 virtual visit copay if you have the Gold PPO plan. The virtual visit is not available on the Gold HMO plan, so that's important for you to keep in mind. For emergency room visits, again, on the Silver PPO, you must cover the cost up to $3,000 if they're a network. After that, everything will be covered at 100%. For the Gold PPO and the Gold HMO plan, you do have a separate emergency room copay of $300 plus 30% of coinsurance after the deductible is met. On all three plan options at Laredo ISD, remember that preventative screenings are covered at 100%. There's no office visit copay. There's no fee that you must pay. Once a year, we're all eligible to go for a preventative screening, and that would be covered at 100% of the cost. For your prescription drug charges, on the Silver PPO CDHP plan, all medications are covered at 100% after the $3,000 deductible is satisfied. For the Gold PPO and the Gold HMO plan, you do have copays for generic drugs of $20. For preferred brand name drugs, $40 copay. For non-preferred drugs, $60. And for your specialty drugs, those are covered with a $250 copay. The rates for the plan stayed the same as compared to last year. So if you're on the silver PPO plan, the CDHP, the employee-only cost is $88.65. Employee and spouse is $566.74. Employee and child or children coverage on the silver PPO plan is $470.83. And for employee and family coverage, it is $1,056.56. For the gold PPO plan, the employee-only rate is $149.52. For the employee and spouse, it's $782.45. Employee and child or children is $655.49. And for the employee and family, the rate is $1,430.98. And finally, for the Gold HMO plan, the premiums are as follows. The employee only is $135.23. Employee and spouse is $707.66. The employee and child is $592.84. And employee and family is $1,294.19. Remember that if you select the Gold HMO plan, that is for Texas only. There's no out-of-state coverage for the Gold HMO plan, and you must list the name of your primary care physician. With the Gold PPO plan or the Silver PPO CDHP plan, there's no PCP or primary care physician required, and you can go directly to a specialist without a referral. To go into detail on all of the separate plan options, the first one we're going to talk about is the Gold PPO plan. That's a plan that most employees have at Laredo ISD. Again, as I mentioned, your annual deductible is $3,500. That runs from January 1st to December 31st. There is fourth quarter carryover available on this plan, and what that means is if you pay your deductible in October, November, December of 2021, that deductible credit is going to carry over to the plan year 2022. The coinsurance after deductible is at 30%. That's the part that you're responsible for. Blue Cross Blue Shield and Laredo ISD will cover the other 70%. And your maximum out of pocket, if you stay in network on the Gold PPO plan, is $8,150. Your primary care physician visits are covered with a $40 copay. Your specialist visit is covered with a $60 copay. There's an urgent care copay for visits there at $75. And you do have access to the virtual visits through MD Live with a $35 copay. If you visit the emergency room has a separate $300 copay, plus you'll be responsible for 30% of the coinsurance after your deductible has been met. Preventative screenings are covered at 100%, and generic drugs have a copay of $20. Preferred brand names have a copay of $40. Non-preferred brand is covered at $60, and your specialty drugs are covered at $250. Notice that if you go out of network, there's more out-of-pocket cost involved. So for your deductible, your out-of-network deductible on the Gold PPO plan is $7,000. You are responsible for 50% of the coinsurance after deductible. Your out-of-pocket maximum is $17,000, plus you may be subject to balance billing. And then for your primary care, your specialist, your urgent care, and your virtual visits, you'll be responsible for 40% of the cost after your deductible is met. You still have the same $300 copay if you go to the emergency room, and preventative screenings are covered at 50% after the deductible is met if you go to a provider that's out of network. The cost for this plan is $149.52 for employee only, $782.45 for employee and spouse, $655.49 for employee and child or children, and $1,430.98 for employee and family. The Silver PPO, which is a CDHP plan, is available also this year. It's the same plan as last year. We have several people that are participating in this. And with this plan, your deductible is $3,000. Your out-of-pocket maximum on the Silver PPO CDHP plan is $3,000. But with this plan, if you notice, there's no office visit copays, there's no copays for your prescription drugs, there's no copays for your specialist. The employee is responsible for the full amount of the cost up until they hit the individual deductible of $3,000. There is no fourth quarter carryover on the deductible on your Silver PPO CDHP plan. And the rates are lower. The rates are $88.65 if it's employee only, $566.74 for employee and spouse, $470.83 for employee and child and children, or $1,056.56 for employee and family. Your out-of-pocket network fees are also higher. If you notice, your deductible is $6,000. Your maximum out-of-pocket for the individual is $10,000, plus you may be subject to balance billing. And then also you're responsible for 100% of the cost for your primary care physicians, your specialty care, urgent care, or your emergency rooms will be covered at 30% after you meet your deductible. So this is a great plan if you know you're going to have some kind of procedure that's coming up and you want to limit your out-of-pocket maximum. It would be $3,000 versus that $8,150 that we talked about on the Gold plan. And this is also for the person that is conscious about this plan and also has the ability to say, hey, I know what my medical expenses look like and I know how I want to use this plan. There is a video available on your presentation here, and you can just click on the icon and you can watch a brief video on what is a consumer-driven health plan and how does it work.
Meet Kate. Kate is not a psychic, but she is good at planning ahead. Kate has a health plan with a health savings account, also known as a Consumer-Directed Health Plan, or CDHP. With a CDHP, Kate can set aside money tax-free to pay for her health care. The savings account can help pay for things like Kate's dental checkups, prescriptions, and contact lenses or glasses. The savings account can also pay for unforeseen things like treatment for a sprained ankle or a child who needs to go to a doctor. In fact, Kate can use her savings account to pay for many qualified medical expenses that might be coming up. Since this savings account is tax-free when used for qualified expenses, it helps Kate save money on healthcare. So who needs a psychic? With a CDHP, you can plan for your healthcare costs ahead of time. And that's a fortunate thing.
Once you get on the consumer-driven health plan, you will have an option to set up a health savings account. And there's information there. There's also a brief video that you can watch on setting up the health savings account. It would be set up with a HSA bank, and then you can also contribute money on a monthly basis into these accounts. There's a certain maximum amount that you can contribute set forth by the IRS, and that information would be available to you should you decide to participate in the Silver CDHP plan.
In a perfect world, medical expenses would always be affordable. But in reality, they cost a bundle. Consumer-driven health plans help you save money while paying for uncovered medical expenses with tax-sheltered funds. And because CDHPs cost less than traditional plans, previously uninsured people can finally afford the coverage they want. There's a plan that fits you perfectly. From HSAs and high-deductible health plans to HRAs and flexible spending accounts, consumer-driven health plans put you in charge of your health care. You decide what procedures, services, or medications your funds are used for. And you can start small. There's no minimum contribution. While we fully manage your employer's CDHP, we also make these plans manageable for you. Online enrollment is easy. Our debit card accesses all your tax-free benefits. And our mobile app makes submitting claims and checking balances a breeze. So if your employer doesn't provide a CDHP, take charge. Encourage your employer to contact us today.
The third plan that we have, which was introduced last year, is the HMO Benefits. That was introduced in 2021. Remember that HMO benefits are available for the state of Texas only. And with this plan, your annual deductible is $3,500. Your coinsurance is 30% after the deductible. Your maximum out of pocket is $8,150. And then you also have the copays for the primary care of $40. For the specialist, it's $60, and there is a referral required from your primary care provider. There's a $75 copay for urgent care, and there are no virtual visits or MD Live available on the HMO plan benefits. Generic drugs are covered with your copay of $20. Preferred brand name drugs have a copay of $40. Non-preferred drugs are covered at $60, and your specialty drugs are covered at $250. One thing I would like to mention for those of you that are taking maintenance medication, which is medicine that you take all the time for either cholesterol, high blood pressure, heart disease, diabetes, thyroid, things of that sort, you can use the mail order program that Blue Cross Blue Shield offers. And should you use a mail order program, you will get 3 months supply for 2 copays. So in other words, buy 2, get 1 free. It's a great benefit. Several of you at Laredo ISD have this benefit, and it works out very convenient to the members that are on medication for the long haul. The HMO plan, as I mentioned, was introduced in 2021. They are continuing this next year. There's a brief video that you can watch, and it'll answer some of the questions as to what is an HMO and how does it work for me.
Meet Sally. Sally likes roller derby, but she doesn't like unexpected medical bills. With an HMO plan, Sally goes to a select group of doctors and providers. It can save her a lot of money. Her HMO keeps her monthly premiums low. And Sally can get free or affordable health care for services like flu shots or physicals. If Sally needs a specialist, her doctor can refer her to one. When Sally receives care from providers in her network, she has the peace of mind of knowing that her co-payments will be manageable and predictable. An HMO plan makes it easy for Sally to receive quality care while also saving her money, so Sally can keep taking the hits while her wallet doesn't.
There are several frequently asked questions about the HMO network. And the first one is, do I need a primary care physician or a PCP? The answer to that is yes, I do. HMO Blue Essentials require that you choose a PCP at the time of enrollment. All of your healthcare services will be coordinated between you and your selected PCP. Do I need a referral to see a specialist? Yes, you do. If you feel you need to see a specialist, you must schedule an appointment with your primary care provider first, and then he or she will provide you with a referral for an in-network specialist. If I have a doctor or specialist that is out of network, can I continue to receive care from them and still be covered? The answer to that is no, you may not. HMO plans will not cover care from an out-of-network provider, a physician, a hospital, or a facility. Exceptions would only apply in the case of a true medical emergency. What about the cost comparison? There's a lower cost associated with the HMO Blue plan as compared to the PPO Gold plan. With the HMO Blue Essential plan, you will have a lower employee contribution. Since your providers are in-network, your out-of-pocket medical services will be lower. If you notice on the PPO, on the right side of your screen, the PPO plan answers those same questions. Do I need a primary care physician? The answer is no. Do I need a referral to see a specialist? Again, the answer is no. If I have a doctor or specialist that is out of network, can I continue to receive care? Yes, you can. And the cost comparison for the PPO plan, it's a higher cost. Know your network. when you're looking at the 3 plan options, most people will stay with the current plan. But if you want to do an analysis and you want to see which plan is right for me, it's important that you know your network. If you're on the Silver PPO, you'll notice that your monthly deductions are the lowest. On the Gold PPO, they're the highest. And on the Gold HMO, it's a medium price. Your annual deductible is lower on the Silver PPO CDHP plan, and it's also higher on both the Gold PPO and the Gold HMO. Are there copays available for the Silver PPO plan? The answer is no, it's not applicable. But on the Gold PPO and the Gold HMO, yes, there are copays available. The coinsurance for in-network, Laredo ISD pays 100% after you've paid your $3,000 deductible. And on the Gold PPO and Gold HMO, the employee is responsible for 30%, and Laredo ISD will pay 70% of the coinsurance after the deductible is met. For the primary care physician, the PCP, there's no copay. It's not applicable that you have a PCP on the CDHP plan or the Gold PPO. It is required, and you must select a primary care physician or a PCP at time of the enrollment. For the specialist office visits, there's no referral required on either the Silver or the Gold plan. The referral on the Gold HMO plan is required from your primary care physician or PCP. There's no coverage outside of the network. Your annual out-of-pocket will be lower on the Silver PPO plan, and it'll be higher on the Gold PPO or Gold HMO plan. Can I choose a flexible spending account or a health savings account depending on which plan I sign up for? If you're on the Silver PPO CDHP plan, you may select a health savings account, but you must select a flexible spending account if you're on the Gold PPO or the Gold HMO plan. For the network coverage, both the Silver PPO CDHP plan and the Gold PPO have nationwide networks. For the Gold HMO, it's Texas only network. So it's important to keep that in mind. If your children are going to school out of state or they live with an ex-spouse out of state, the Gold HMO may not be a plan because that is Texas only network. And again, for out of coverage network, you do have options if you're on the Silver PPO or the Gold PPO, but on the Gold HMO, there's no out of network coverage. And your out of pocket cost is going to be lower on the Silver PPO CDHP plan. It will be higher for the Gold PPO and the Gold HMO plan. How do I select a primary care physician? If you click on the Find a Doctor icon, they will give you a list of physicians that you may choose that you must select if you're going to be on the HMO plan. Again, to recap the 2022 medical plan options, you must select one of the 3 plans that are available. Right now is a time to make changes in case you want to add somebody onto the plan or take somebody off of the plan. All of these changes will go into effect on January 1st, 2022, and then the plan highlights are there for you to review. Your options are the Silver PPO CDHP plan, which has a $3,000 deductible and the $3,000 out-of-pocket maximum. Or you can also choose the Gold PPO or Gold HMO that has a $3,500 deductible and the $8,150 maximum out-of-pocket for both the Gold PPO and the Gold HMO plan. There are no office visit copays or no prescription drug copays with the Silver PPO plan. There are available for the Gold PPO and the Gold HMO plan. And then the rates are listed there for you to compare as to which plan will work for you. Who can join your health plan? All full-time Laredo ISD employees and their eligible dependents are allowed to participate in the benefits program. Laredo ISD families will require certain documents to prove eligibility. And if you're gonna add your spouse onto the plan, they will require the marriage certificate or common law certificate, a valid social security card. The spouse does not have access to medical coverage through their employer. And for children up to the age of 26, they will require a birth certificate, valid social security card, a medical child support order, or court orders, adoption or guardianship orders. A marriage license is required if you're adding stepchildren onto the plan. Please keep in mind that the Laredo Independent School District conducts dependent verification audits to ensure the validity of the dependents that are covered. Dependent verification audits protect medical plans from ineligible dependent coverage, which in turn helps ensure that benefit dollars are only being spent on eligible participants. This is one way to keep your health care costs down. When enrolling on Laredo ISD's health insurance plan, you acknowledge that providing any false information or omission of relevant information may result in denial of claims and or cancellation or rescission of coverage. It is important that all non-eligible dependents are reported immediately to the Health and Benefits Department. Failure to report a loss in eligibility status will result in reversal of paid claims for that dependent. Blue Cross Blue Shield has an application or an app available for your mobile devices. And if you want to download the BCBS TX app, all you need to do is type in the letters BCBS TX APP and send it to the number 33633. And that'll automatically download the app onto your device. With that app, you'll be able to find in-network doctors, hospitals, or urgent care facilities, or search for certain doctors or Spanish-speaking doctors. You'll have access to your claims, your coverage, and your deductible information. You'll be able to access your digital member ID card, and you can also check information and be tied into the Blue Cross Blue Shield system for any kind of questions or items that may arise. Several of you have already completed your health risk assessment. This is something that we recommend that you do on an annual basis. And by logging on to the bcbstx.com website, you can look under the member wellness portal, and there's several information or several highlights that you can look at. You have access to the member dashboard, to several trackers and tools. You have access to text message alerts, health and wellness content, a fitness program, tracking for fitness and nutrition, and several other options that are available. This is available to you free of cost and is an excellent tool for you to have when you're reviewing your health insurance benefits. Aside from the health insurance benefits, there are several other optional benefits that you may participate in. The plans that we have offered in the past are going to be the same plans. There's no change. The first one that we will look at is your dental plan. Your dental plan is with Delta Dental. Several of you have had this plan for many years already. And this plan covers 3 types of services. The first is preventative services. Those are exams, cleanings, x-rays, things of that sort. That's covered at 100% when you use an in-network provider. You may go twice a year to get your teeth cleaned, and that's covered free of cost. If you need to have a basic service like fillings, simple tooth extractions, that will be covered at 80% after your deductible. The member is responsible for the $50 annual deductible and then 20% of the bill. Major services like your crowns, inlays, onlays, cash restorations, root canals, those are covered at 50% after your deductible. There is a 12-month waiting period if somebody signs up for the dental plan and they need to have some kind of major services. Your preventative and basic services are covered immediately. There's no waiting period for that. But for your major services, there is a 12-month waiting period. Orthodontics are covered for dependent children, and it's only 50% after the deductible with a $1,000 lifetime maximum. The rates for the dental plan stay the same, which is $23.94 for employee only, $42.28 for employee plus one dependent, $67.84 if it's employee and one child or the family. So you have your option to include yourself plus one, or your whole family, and the rates are there reflected. The vision plan this year is also with Superior Vision. There's been no change to that. There's two plans available, which is the Platinum and the Gold plan. And both plans have a $10 comprehensive eye exam, a $25 copay for materials. You may get an exam every calendar year, and your lenses or frames can be replaced either every 12 months on the Platinum plan or every 24 months on the Gold plan. The employee-only rate for the Platinum is $6.65. Employee plus one on the Platinum is $11.36. And the family rate on the Platinum plan is $16.65. The rates for the Gold plan, employee only, are $5.48. Employee plus one is $9.35. And the family on the Gold plan is $13.70. Voluntary Life and AD&D insurance. This is underwritten through Sun Life. This is the same plan that we've had for the past several years, but it's important to note, there on the right-hand side of your slide, that it says employees must complete the online enrollment in order to retain this benefit. Failure to do so will result in termination of coverage. It's very, very important that you complete your online enrollment if you're currently on the plan or if you'd like to sign up for the first time. Employees can get the lesser of 6 times your annual earnings up to a maximum of $500,000. There is a benefit reduction to 65% at age 70 and at 50% at age 75. Coverage ends at termination of employment or retirement. You may be able to continue your coverage through either conversion or portability, but it's important that if you do want to continue your coverage once you retire or you're terminated, that you notify the district within 30 days of your separation date. Spouse voluntary life is also available. The maximum amount of insurance a spouse can get is $100,000. The spouse coverage cannot exceed 50% of the employee coverage amount, and the spouse rates are based on the employee's age. Spouse coverage ends at age 70. Child voluntary life is also available. The maximum amount of insurance is $10,000 per child, and they're covered from birth all the way up to age 26. The life insurance is subject to underwriting and is not guaranteed issue. Again, if you're currently on this plan for the voluntary life through Sun Life, it's imperative that you complete your online enrollment form in order for you to retain this benefit. Disability insurance is another option. That's also underwritten by Sun Life Financial. With disability insurance, you can get a weekly check after your claim is approved, anywhere from $200 a week all the way up to $7,500. And that replaces up to 66.7% of your total monthly earnings. You design the plan the way you want it. Benefits will be paid up to age 65 or the Social Security normal retirement age. Pre-existing conditions will apply to the disability insurance. For a period of time following the effective date, the Sun Life will not pay a benefit for pre-existing condition for which you previously sought medical treatment, consultation, had advice, had some care devices placed, regardless of whether the condition was diagnosed or suspected at the time, or if you took prescribed drugs or medicine. Please read the exclusion and limitations for more information. Again, on this plan, if you're currently on disability insurance, employees must complete the online enrollment in order to retain this benefit. Failure to do so will result in termination of coverage. There's several elimination periods that the employee can choose from, ranging from choice 1 all the way up to choice 6. And the elimination period are the number of calendar days you must wait before you're eligible to file for disability insurance. So for instance, choice 1 has a 0 day for injury, 3 days for sickness. Choice 3 has 14 days for injury or for sickness. And choice 4 has a 30-day waiting period for either injury or sickness. So you can review the disability insurance options. If you have questions, please call Laurel Insurance at 956-724-9083 and ask the questions that are available. Remember, disability insurance is just for the full-time employees of Laredo ISD. You cannot include your spouse or your children on disability insurance. The last plan that we have is a MetLife Cancer, Specified Disease, and ICU plan. And again, this is a group cancer plan. Very important, employees who are currently on the MetLife Cancer, Specified Disease, and ICU plan must complete the online enrollment in order to retain this benefit. Failure to do so will result in termination of coverage. And with a group cancer plan, they pay you a lump sum cash payment for certain procedures, screening, treatments that you may have related to internal cancer diagnosis. Payments are made directly to you and can be used for any purpose. There's a first diagnosis benefit if somebody's diagnosed with internal cancer. They cover radiation, radioactive isotopes therapy, chemotherapy, or immunotherapy. It covers treatment administered by a radiologist, chemotherapist, or oncologist on an inpatient or outpatient basis. There's a waiver of premium benefit, which means that after 60 continuous days of disability due to cancer or your specified disease, premiums will be waived starting on the first day of your policy renewal. There is a pre-existing condition limitation for the cancer plan, and the specified diseases include things such as ALS, encephalitis, lupus, Lyme disease, meningitis, epilepsy, and others that are covered under the policy. A person may elect the hospital intensive care confinement benefit, and they can choose a benefit in the amount of $325, $425, or $625 per day. The benefit is reduced by 1/2 once the member turns age 75. For any questions or comments you may have in reference to your 2022 open enrollment, please call Laurel Insurance. Our office number is 956-724-9083. You may send us an email at info@laurelasssoc.com, or you can also visit our website, which is www.laurelasssoc.com. Our office hours are Monday through Friday from 8:30 to 5:30, and we're here to answer any kind of questions you may have. Thank you, and God bless.